Ever wondered why headaches are so common? It's a question that has crossed many minds, as headaches are a universal experience, touching lives from every corner of the globe. They come in various forms, each with its own unique characteristics and triggers. From tension headaches that grip like a vice, to the crippling pain of migraines, to the agonizing torment of cluster headaches. Each type of headache has its own story to tell, its own mystery to unravel. In this video, we will delve into the scientific reasons behind common headaches. Headaches are not all the same. There are different types, each with its own characteristics. Let's dive into this world of aches and pains, looking at three of the most common types: tension headaches, migraines, and cluster headaches. First up, we have tension headaches. They're the most common type of headache among adults and teenagers. Just like an unwelcome guest, they often pop up in the middle of your day, causing mild to moderate pain, often described as a tight band around your head or pressure at your temples or back of your head. They're usually caused by muscle contractions in the head and neck region, often linked to stress or anxiety. Next up, we have migraines. These are the divas of headaches, unpredictable, intense, and debilitating. They're characterized by a throbbing or pulsing pain, usually on one side of the head, and can be accompanied by nausea, vomiting, and extreme sensitivity to light and sound. Migraines can last from a few hours to 3 days, and the exact cause is still a topic of scientific debate. Last but not least, we have cluster headaches. These are the rarest and most severe type of headache. They're characterized by recurrent, severe headaches on one side of the head, typically around the eye. Imagine a hot poker being thrust into your eye. That's how intense the pain can be. Episodes can last from 15 minutes to 3 hours, and occur once or more times a day for weeks or even months, followed by periods of remission. So, there you have it. 3 types of headaches, each unique in their own way. They have different causes, different symptoms, and require different strategies for relief. But why is it important to differentiate between them? Well, it's simple. Knowing the type of headache you have can help you and your healthcare provider find the most effective treatment strategy. Understanding the type of headache you have is the first step in finding out why it's happening. Ever feel like you have a tight band around your forehead? That's a tension headache. Tension headaches, often described as feeling like a tight band around the head or a weight on the shoulders, are the most common form of headache. But what actually causes this uncomfortable sensation? The answer lies in the muscles and nerves of the head and neck. Our bodies are a complex network of interconnected parts, and when one part is affected, it can easily impact others. In the case of tension headaches, the culprit is often muscle contractions in the head and neck region. These contractions can cause a throbbing pain that's often felt in the forehead, temples, and back of the head. Now you might be wondering what triggers these muscle contractions. Well, 2 common instigators are stress and poor posture. When we're stressed, our bodies are in a state of high alert. This can lead to muscle tension, which, if located in the head or neck, can result in a tension headache. Similarly, poor posture, especially when sitting for long periods, can strain the muscles in the neck and shoulders, again leading to tension headaches. But it doesn't stop there. The pain signals from these muscle contractions can also stimulate the nerves in the head and neck. These nerves can then send pain signals to the brain, amplifying the discomfort and making the headache feel even worse. And here's a fascinating fact. Not everyone experiences tension headaches the same way. Some people may have a dull, aching sensation, while others might feel a sharp, piercing pain. The intensity and frequency of tension headaches can also vary greatly from person to person. So the next time you're stressed and your head begins to throb, know that it's your body responding to that stress. Understanding the science behind tension headaches can help us better manage them and even find ways to prevent them. Remember, your body is an incredible machine, and knowing how it works is the first step in keeping it running smoothly. Migraines are more than just severe headaches, they are neurological conditions. These are not your everyday run-of-the-mill headaches. No, they are a complex interplay of genetic, environmental, and neurological factors that lead to an intense, often debilitating pain. Imagine it like this. Your brain is a bustling city. The neurons are the city's inhabitants, constantly communicating and interacting. In a healthy, headache-free brain, these interactions are smooth and orderly. But when a migraine strikes, it's as if a riot has broken out. The city's inhabitants are in disarray, leading to chaos and ultimately pain. This chaos is thought to be sparked by imbalances in brain chemicals, particularly serotonin. This neurotransmitter, often dubbed the feel-good hormone, plays a crucial role in regulating pain in your nervous system. During a migraine, serotonin levels drop, causing your trigeminal nerve to release neuropeptides. These substances travel to your brain's outer covering, causing blood vessels to dilate and inflame, resulting in severe headache. Genetic factors also play a significant role in migraines. Studies show that if one or both of your parents suffer from migraines, there's a good chance you will too. It's like inheriting your father's eyes or your mother's smile, except this is one inheritance you'd probably rather do without. But migraines are not just about the headache. They often come with other symptoms like nausea, vomiting, and an increased sensitivity to light and sound. Some people even experience a phenomenon called an aura before a migraine begins, where they might see flashing lights, blind spots, or feel a tingling sensation in their limbs. While migraines are complex and still not fully understood, we do know that they involve a lot of factors, both internal and external. They are a neurological mystery, a puzzle that scientists are still trying to piece together. And as we continue to delve into this enigma, we come closer to finding effective treatments and perhaps, one day, a cure. Until then, understanding the nature of migraines is our best tool in managing them. Ever heard of a headache that's so severe it's been dubbed the suicide headache? Meet the cluster headache. In contrast to tension headaches and migraines, cluster headaches are a rare breed. They're called cluster headaches because they tend to occur in groups or cycles, a characteristic that sets them apart from other types of headaches. Cluster headaches are a neurological disorder, and in terms of pain, they're often described as one of the most excruciating experiences a person can go through. Imagine a sharp, burning pain, typically localized around one eye or one side of the face. That's a cluster headache for you. But what causes this extreme discomfort? The precise cause is still under investigation, but research suggests the hypothalamus, a small region at the base of the brain, plays a key role. This area controls our body's internal clock and is responsible for our sleep-wake cycle. Some scientists believe that abnormalities in the hypothalamus may trigger cluster headaches. The onset of a cluster headache is usually rapid, with severe pain developing in less than 15 minutes and lasting anywhere from 15 minutes to 3 hours. Unlike migraines, which make sufferers want to lie still in a dark room, cluster headaches often provoke a restless and agitated response. Symptoms can be intense. In addition to the excruciating pain, you might experience a red or teary eye, a runny or blocked nose, and a drooping or swollen eyelid, all on the same side as the headache. Unfortunately, there's no definitive cure for cluster headaches just yet. However, understanding the nature of these headaches is a crucial step towards managing them. Treatments often aim to reduce the severity and frequency of the cluster periods, and to alleviate the pain when an attack happens. Cluster headaches may not be as common, but for those who experience them, understanding why they happen can be a crucial part of managing them. Now that we understand the science behind different types of headaches, what are some common triggers? Let's dive deeper into the world of triggers, those sneaky instigators that spark off our headaches. Many factors can set off these painful episodes, and understanding them is a big step towards preventing the onset. One major culprit is stress. Whether it's work-related, comes from personal relationships, or is due to other life events, stress can tense up your muscles, especially those in your neck and scalp, leading to tension headaches. So what's the solution? Mindfulness and relaxation techniques, of course. Incorporating activities such as yoga, meditation, or even just taking a few quiet moments for deep breathing can work wonders in reducing stress levels. Next on the list are certain foods. Yes, what you eat can sometimes give you a headache. Foods high in nitrates like processed meats and those high in tyramine, such as aged cheeses and fermented foods, can trigger headaches in some people. Even chocolate and caffeine can be triggers for some. The key here is to identify the foods that trigger your headaches and then limit or avoid them. Now, let's talk about sleep, or rather, the lack of it. Not getting enough sleep can trigger both tension headaches and migraines. And it's not just about the number of hours you sleep, but also about maintaining a regular sleep pattern. So make sure you're getting 7 to 9 hours of quality sleep each night and try to stick to a regular sleep schedule. Dehydration is another common trigger. When your body doesn't get enough water, it can lead to a headache. So keep that water bottle close by and aim to drink at least 8 glasses of water a day. Eye strain, especially from screens, can also cause headaches. If you're spending long hours in front of a computer, tablet, or smartphone, make sure to take regular breaks, adjust your screen brightness, and consider getting a pair of blue light blocking glasses. Physical exertion, like heavy lifting or intense exercise, can also trigger headaches. While staying active is crucial for overall health, it's also important to listen to your body and not push it beyond its limits. As you can see, There's a wide array of triggers, and they can differ from person to person. But the good news is, once you've identified your particular triggers, you can take steps to avoid them, and thereby reduce the frequency and severity of your headaches. Remember, maintaining a healthy lifestyle that includes a balanced diet, regular exercise, adequate hydration, and plenty of rest can go a long way in preventing headaches. And don't forget to take time for relaxation and stress management too. Remember, prevention is better than cure. Identifying and avoiding your triggers can save you a lot of head-throbbing pain. Headaches can be a real pain, but understanding why they happen can help us manage them better. We've taken a deep dive into the world of headaches, exploring the different types, their scientific causes, and how to prevent them. We started by acknowledging the various types of headaches we encounter, from tension headaches, the most common of them all, to the excruciating cluster headaches, and the mysterious migraines that seem to have a mind of their own. We then delved into the science behind these headaches. We learned that tension headaches often occur due to muscle contractions in the head and neck region, often triggered by stress or poor posture. Migraines, on the other hand, remain a mystery, with theories suggesting a complex interplay of brain chemicals. Cluster headaches, although rare, are intensely painful, and seem to be linked to the body's biological clock. We also discussed common triggers, which can range from certain foods and alcohol, to stress and changes in sleep patterns. Recognizing these triggers can be a significant step towards prevention. We also emphasized the importance of a healthy lifestyle, regular exercise, good posture, and adequate hydration in preventing headaches. Next time your head starts to pound, remember the science behind it, and take steps to soothe your brain. Because when it comes to headaches, knowledge really is power.